Now, one of the major branches of the vertebral artery, it is going to contribute towards the anterior spinal artery. There is only a single anterior spinal artery as compared to the posterior spinal arteries, which are basically two in number. So how is it formed and how does it descend down, and what are the major distributions and the areas which is basically it is going to cover? So as the name is indicating, it is going to be present anteriorly. So it is going to basically supply the anterior portions of the vertebral column as well as the spinal cord. As you can evaluate from this particular diagram, we have the basilar artery, which is basically formed by the combination or the combining of the two vertebral arteries from both sides. From the right and from the left side, the vertebral arteries, they basically join together. And they're going to form the basilar artery at the base of the skull or at the foramen magnum. Now, from this particular formation of the basilar artery, some of the fibers or some of the branches, they're going to descend down anteriorly, and they're going to form the anterior spinal artery as shown in this particular figure. So we have this single anterior spinal artery on one hand, and on the other hand, we have the two posterior spinal arteries. So this is the comparison that you're going to follow over here. Then moving on, we have the segmental arteries as well. So when we look at this terminology and the name segment appears, it is basically quite known that it is going to follow the intercostal branches and is going to basically supply the different segments of the spinal cord. They're going to enter through the different foramina, for instance, the foramen transversarium, and it is going to basically supply the vertebral columns accordingly. Then moving on, we have the radicular artery, particularly the anterior radicular artery. And then moreover, we have a posterior radicular artery. Now this anterior radicular artery and this posterior radicular artery, they're going to descend down and they are going to supply the different areas as well. And when you look at these radicular arteries, you're going to basically look at this fact that they are following the nerve roots. So we have a dorsal and then we have an anterior portion or a ventral portion to these particular branches of this radicular arteries. This is again, when we look at the cross section, you would just appreciate this fact that this is the anterior spinalis artery. And then we have some of the sulcal branches, which they are basically going to intervene and they're going to supply this sulcar area as well. They're again the branches of the anterior spinal artery. So this is the radicular artery and is going to follow the nerve roots, particularly the dorsal, and then we have the ventral portions as well. This is the segmentalis artery and is basically going to branch off into the two radicular arteries. We have a ventral portion and then we have a dorsal portion, which is related to this radicular arteries as well. This is the anterior radicular artery, which is also known as the arteria radicularis anterior and mentioned accordingly. This is the anterior spinalis artery, and this is again giving off the sulcal branches and is again entering the gameter as well from this particular anterior median fissure. So these are again very important, and these interbranches are going to make sure that the different segments of the spinal cord are covered when they are going to branch off. So these are the major arteries and these are the major subdivisions that are being discussed over here, particularly regarding the anterior spinal artery.